My audio should be. Why are you being on talking now? Yes. All right. All right, so good evening, everyone. You all hear me? Can we hear me online?
Yeah.
Not just his- Welcome, everyone. This is the Human Services Committee meeting of April 13th, 2026. It's 40 approximately. Oh, 5 minutes past. It might be 6:35. Oh, it's 6:40. Welcome. I'm going to call the meeting to order. I've just done that. Now we're going to do roll call.
You want to do ground rules?
Oh, that first. All right, so first, ground rules. No one may speak until granted the floor. These are ground rules, everyone. No one may speak until granted the floor. CB11 members, if you have a question about board business or wish to make a motion, please raise your hand and wait to be recognized. To raise your hand through Zoom, click the participants icon and you will find the raise hand function there. Members should not engage in a back and forth discussion. The chair will recognize the next person to speak. Please keep your questions and comments brief and on topic to the discussion. Members of the public, if you have a question or comment about the subjects on the agenda, please raise your hand and wait to be recognized. Roll call now. Roll call.
Leslie Colon, present. Annika Rizzi, present. Chancellor Greg,
Present.
Jill Jones,
Present.
Jennifer Meyer is absent for this meeting. Tanya Phelps,
Present.
Valerie Ponte, absent, and Robin Stration.
Present.
We have a quorum.
Excellent. Great. Thank you. So we all saw the agenda and I sent it out to folks. Any question about the agenda, comments? If not, we're going to adopt the agenda. Seeing no questions or comments, we're going to adopt the agenda. Thank you. You all see the copy of the minutes. I hope you took a look at them. These are the March 9th, 2026 minutes. Any questions or comments? If not, we're going to adopt the agenda as is. Okay, we're adopting the agenda. There's okay. Announcements.
Jill, sorry to cut you off.
Sure.
You're reading the entire thing into the.
Oh, yeah.
record, And then I'm taking the slide down.
Okay. So I'm gonna go through the entire agenda. All right, so for today's meeting, I'm just gonna read the whole entire agenda. There was a call to order, there was a roll call, adoption of the agenda, adoption of committee minutes, adoption of the March 9th committee meeting minutes. Announcements, there will be announcements or informational updates, 5 minutes for those. Second. For announcements, informational updates, we can Harlem Hospital's CAB legislative event that took place on April 10th. New York City Department of Health and Mental Hygiene, we'll hear from them. New York City Health and Hospitals, Metropolitan Hospital Center, if someone's here, we'll hear from them. If someone's from Harlem Hospital, we'll hear from them. And if someone's here from Henry J. Carter, we'll hear from them. New York City Human Resources Administration, Department of Homeless Services, if there's someone here, we will hear from that person. We will hear from the New York City Department of Aging. Office of Immigration Affairs, Department of Veterans Affairs, the Center for Comprehensive Health Practice, Housing Works Connect program, and On Point for your NYC. We have Jason Beltry. That's a standing item, so everybody knows. In terms of presentations and discussions for tonight, we have informational presentation about Mount Sinai Silikoff Centers for Occupational Health and Workers' Compensation. Located at 1468 Madison Avenue, New York, 10029. Michelle Cornell. And sorry about your last name. Outreach and Education Program Coordinator will be presenting, and then we have informational presentation about rat mitigation in East Harlem. We have Pauline Ferranti, Manhattan Liaison, Department of Health and Mental Hygiene, and Martha Renaza. Sorry if I am mispronouncing your names. The community coordinator at Department of Health and Mental Hygiene. And then we will have presentations and discussions. So there's a budget request submission form. That's a standard form that all committees have on their agenda. We have it on our agenda. I'll discuss it momentarily. And in terms of old business, we will have a continued discussion about the updates and edits to the existing resolution calling for a moratorium on the sitting of any new drug rehabilitation, chemical dependency, or treatment centers within Manhattan Community District 11. And then we have new business roll call and an adjournment. Okay, you too. All right, so the minutes. So getting back to that. Did we already adopt the minutes?
No.
Okay, well, we did.
The minutes from March 9th?
Yeah.
Yes, we did.
Okay, we're moving on. So announcements. All right, so the Harlem Hospital legislative event. I did not make the legislative event. Anyone go to the Harlem Hospital CAB event from here? Okay, perhaps our chair did. I'll reach out to him to find out. So I was actually letting everyone know about each of the CAB events. Metropolitan had theirs, Bellevue had theirs, Henry J. Carter had theirs, and then Harlem Hospital had theirs just this past week or last week. We try to make each of those CAB events. They're very important events. Other announcements. Before I get to the informational updates, I do have an announcement to make. Let's see here. I just want to make mention of the fact that I attend the East Harlem Community Health Committee meeting, which takes place every month. It's a general membership meeting of different community health committees, nonprofits, stakeholders within East Harlem. And there's like 50, 60 people on this at this meeting. So it's very important. And I try to attend this thing every month. It's actually virtual, so I can give out the Zoom information to you all. It really is it's very important that folks attend. So as an example, in terms of what they discuss, they have standing committees or subcommittees actually, behavioral health, older adults, etc. But then they have the discussion that took place this past month, last week, talked about the Neighborhood Action Center, East Harlem Neighborhood Action Center. We heard from the Human Services Consortium, and just other member updates. So it's very important that that's a very important. Again, it's virtual, so and really there's like 50, 60 people within the community that attend this meeting. So I will send out the Zoom link as soon as I get it for April's meeting. Also happens is the there's a East Harlem Community Partnership meeting that takes place every month as well. That took place last week. I did not attend that one. That's in person. It takes place at part of Union Settlement. That's a very important meeting as well. A lot of folks go there, discuss their organization, upcoming events, but pivotal information for East Harlem residents. So that's a meeting. That's in person, as I said. So if you can go to that, again, I will send out the email. It's every month on the second Wednesday of each month. You don't need me to send an email on about that. Just want to make mention of those two things that I attended. Anyone have any announcements they wish to make? Okay.
Hi, my name is Nana Aheem. I'm from WARM, a domestic violence organization with Stanford We Already Matter. Today I want to talk about our holistic center. Free. We have 8 different programs: massage, yoga, meditation, acupuncture. All you have to do is just call and show up. But we also have our support group program, which we teach and enlighten you how domestic violence stem from, the signs of domestic violence, and how to deviate yourself from domestic violence. And,
So you want just still your name again, your contact information.
Yes, my name is Nana Aheem.
Can you spell that? Yeah.
Nana. That's the first name, last name Iheme. Yes.
And your title again with the
Outreach coordinator.
and what's a contact email?
My email Aheme, Iheme @warmny.org.
Okay, great. And where are you located?
8 West 126 between 5th and Lennox.
Okay, great. And you left some materials here for us?
Yes.
So what's this about?
That's our support group program that we teach and enlighten people. You don't have to be a client. it's a wide, worldwide thing where he could just come teach you how domestic violence starts from, where it stems from, the signs of domestic violence, and how to defend yourself from it.
Okay, and what's the other stuff here?
That's our holistic center, where we have 8 different programs, which we have all free. We have yoga, meditation, acupuncture, somatic experiencing, internal family system, cranial safe role, where you can just call, make your appointment, and show up.
Sounds good. Any questions for? Okay, thank you very much. Thank you. Anyone else?
Yes. So hi, everybody. Tamika Mack, your district leader for Part D. Tom Knopfley is going to be here in East Harlem at 435 East 120th Street tomorrow at 7:30. So you're more feel free to come out to meet your state controller. It's very, not common, the state controller don't come to our community all the time, and this time he wants to come. The survey is out for the City of Living. I sent an email out earlier. The survey is due on May 6th, and they're asking everybody to rate the city agencies. You only get 4 per survey. I'm telling people, if you have more than one email and you want to rate more than one service, please use all your emails that you have available to get your voice on the table for the survey. So Tamika Mack, District Leader, Part D, ehcfgg.info for all important information for East Harlem. Thank you.
Thank you. Say the event date, time, and location.
Tomorrow, April 14th, 7:30, Community Center, 435 East 120th Street.
Thank you.
Marlene? Yes.
Can you move Carlos Diaz as a panelist, please?
He's not on the committee, so he has to stay as an attendee.
Oh, okay.
Thank you. Okay. Anyone else? Okay, thank you.
Can I just, you said the time is 4:30?
7:30.
Okay, right, so let's get into our informational updates. Actually, if it's all right with the committee. Okay, who's first? Michelle is first, and then we have.
You have a hand raised.
Oh, sorry.
Rebecca
Let's see.
Weiner, sorry.
Yes, Rebecca, your hand is raised. You have a question?
Yes, hi, I'm Rebecca Weiner from CUNY SPH Harlem Health Initiative. I just have an announcement to share. We're running a lupus awareness campaign for the month of May, specifically dedicated to reaching Black and Latina women between the ages of 18 and 25 and provide education on early symptom recognition and the importance of timely medical care. So as elements of this campaign, we're sharing assets on social media and interviewing community members with lived experience. So we created a toolkit that we shared with you by email, and we made it simple to participate in the campaign in 2 specific ways. The first is through amplifying the messaging through sharing the graphics and assets on social media. And the second is through direct outreach. So we've drafted ready to use email templates that community members can share with their networks to encourage the conversation, and also the campaign website for additional resources.
And one more time, say the whole thing again. You said lupus awareness?
It's our lupus awareness campaign.
Great. Any questions for Rebecca Weiner? And you said you sent an email, you sent information, is that correct?
Yes,
To whom?
I sent it to the main CB11 email address.
Okay, great. Was this recent?
Yes, today, this afternoon.
Okay, great. Thank you very much.
Thank
For
you.
that. Sure. Anyone else online that wishes to, besides those that are actually presenting today? Okay. Great.
I have an announcement.
Let them, yes, who's speaking? Oh, yes, Madison, yes.
Hi, my name is Madison Ayala. I'm sorry. Do you guys hear an echo?
No.
Okay. My name is Madison Ayala. I'm the Government Affairs Officer at New York City Department for the Aging. I just have, I would say 2 quick updates.
Sure.
Sorry, give me 1 second. I was hearing an echo, I'm sorry. Okay. One of my updates is that we expanded. Oh, let me just start with we actually have a new commissioner, Dr. Lisa Scott McKenzie, who came from Health and Hospitals. She just started with us, so we're looking forward to welcoming our new commissioner. She's doing OAC visits throughout the 5 boroughs right now to get acquainted. And then the second announcement that I have is that we expanded our older adult home modification program. So if you know any older adults or loved ones in need of home modification, such as grab bars, raised toilet seats, non-slip flooring, anything like temporary ramps, things like that, feel free to reach out to me. I'll drop all my info in the chat. There are some eligibility requirements, so you have to be 62 years or older, own or rent in New York City, and then there is an income threshold you have to meet. So it has to be household income less than or equal to 80% of the local AMI, and that's about it that I have for the committee. If anyone has
Right.
any questions, feel free.
So just so we know, you'll be attending regularly, is that situation? And you're muted. That's it. You're muted, if you're speaking, you're muted. Or you're perfectly muted. So, so the question is, so we have these standing agency, and we'd like to hear from these agencies every month, so are you the person that will be
Permission in
attending?
the chat if the chair or the co-chairs of this committee wanna touch base with me at any time.
I'm sorry, if we didn't hear the first part of what you're saying, so just so let's backtrack. So this is a standing committee agenda item. Will you be the individual that will be coming every month? Or someone from Department of Aging?
No, we don't usually do committee meetings after hours. After 6, because that's like considered over like after hours, so we usually share our updates at the DSC meeting and then let the DM share it on the DM report or with the committee. And then also the committee should have my contact information if you guys ever just wanna hop on the chat during work hours or anything like that.
And your contact information is what?
Madison Ayala, and I'll drop my email and phone number in the chat.
All right, so I have maging.nyc.gov, correct?
Uh-huh. Yep.
And phone number 212-602-4438, correct?
Yep.
Okay, great. So that's a contact. So just so, I'll say this. I've been a part of Committee 111 for a while. I was on the board, many decades ago and came back. But we routinely would have standing items of having agency representatives come at the committee level. And typically, community meetings take place in the evening because a lot of our members are working folks, and committee meetings happen in the evening. So I heard what you said, and I can't get into the specifics of your work, but it would be great if that happens, where we have representation from the Department of Aging here at a meeting here. So that being said, I strongly encourage. Feel free to if you need to speak to me separately, or if I need to speak to someone at Department of Aging separately. But I realize at the district service level, folks come, it's during the day. But as community members, we typically will have meetings in the evenings, and representation from community from agency is quite welcome, and I would even say encouraged. So thank you for that. I have to ask a question. In terms of your role at the Department of Aging, it says Manhattan Government Affairs Officer. Is that correct?
Yes.
Okay. In terms of that, if we wanted information as it relates to, I don't know, for example, like the number of senior centers within East Harlem, would you be able to provide that data?
Yes, if you give me just maybe like the community district or like city council district you're trying to refer to, I could pull that up for you and give you a list of all of them in CB11 if that's what you wanted.
So it's from the confines of Community District 11, and the council person is Elsie Encarnacion.
Mm-hmm.
So, yeah. if
But do you
that's-
want but would you want just CB11 or the council district? Because if I'm not mistaken, LC Encarnacion's district goes into the Bronx too, if I'm not mistaken. So I would probably give you some Bronx older adult centers too. So that's what I would just need like the district that you're referring to specifically.
Okay, that's great. So that answered this question here, everybody. So the person that sent this information, this thing about the, all right, so thank you very much for that. And also, so also, I follow with the New York City Council and the Committee on Aging, and this month, the Committee on Aging discussed items such as addressing social isolation rather among older New Yorkers, an amendment to the administrative code in terms of wellness checks on older adults during certain weather events. There was another in relation to requiring the Department for the Aging to maintain non-digital access to forms and services. And the fourth item was a resolution calling for New York State legislation to pass and the governor to sign. I'm not going to go into the actual legislation, but authorizing the New York State Office for the Aging to establish, operate, and maintain programs for transportational services. So if I so an example, if I wanted to reach out and speak to a Department of Aging representative about these pieces of legislation before the city council, would you be someone that would be able to respond, or someone from your agency at the committee level?
Yes, definitely. You would just have to be a little more specific because, for example, wellness checks don't fall under our agency. HRA, like Adult Protective Services, usually handles things like that. So that would be a different agency. And then New York State Office for Aging is NYSOFA, which isn't us. That's the state. So it's just some things that I wouldn't be able to really get to the bottom of. But if it was something that had to do with New York City Department for the Aging, then I could definitely, reach out. You could definitely reach out to me, and then maybe I could even connect you to our legislative analyst to give you more more answers and things like that. But yeah, definitely.
Excellent. I appreciate that so much.
Mhm.
Any
I
questions?
just have a quick question.
Yes.
How do y'all track,
Thank you.
abuse allegations inside senior center homes? Because I have a couple of seniors that say they being emotional abuse, and when they are talking about it, all that person do is go to another center. How are we tracking that?
By senior center homes, do you mean retirement homes, or do you mean like?
Talk about your senior home, the senior centers where there's seniors come in and do programming in various agencies. Some of these people are talking really bad to some of the seniors, and they coming to me and saying they feel emotionally abused, and when they speak up, all the person does that runs the center goes to another center. How are we keeping track of that statistics? Because, the goal is for our seniors to come into the center and have a safe space. They shouldn't feel like they're being abused when they're coming in.
Yeah, definitely. I agree with that. We have program officers at every older adult center throughout the 5 boroughs. So if an allegation like that is made, we would have that on a file. We would just have to reach out to the PO of that center. If you're hearing anything like that, please feel free to reach out to me.
Okay.
I had no elected officials or community partners have raised any flags for me. And as far as Manhattan, I'm not sure about the other boroughs because I just covered the borough of Manhattan, but I haven't gotten anything like that as of lately. We've heard stuff like that happen. I more so hear stuff like that happen for nursing homes and stuff like that, and that falls under NYSOFA because we don't have anything to do with the nursing homes. That falls under the New York State, and that's usually the ombuds office you have to reach out to. And yeah, but as far as our older adult centers, I haven't. And if there is something like that happening, then our POs would probably hear about it. I hope I'll hear about it, but I haven't heard anything like that. But if you do, please feel free to reach out to me or your electeds or anyone to get in contact with me.
Okay, thank you.
Thank you. Any other questions on the Department of Aging? Thank you so much, Madison, for being here. We truly appreciate that.
You have a hand up.
Oh,
Okay, right here.
yeah, East Rom Coed. Yeah, East Rom Coed, yes. And who might we be speaking to?
Hi there. My name is Maya. I raised my
Maya.
hand because, hi, I wasn't sure if this was the time since we usually would present monthly. If I should raise my hand to speak or if I should wait for you to
Yeah,
shout us
actually,
out.
I'm gonna go down the agenda. You're coming up shortly.
Thank you so much.
And say your name one more, Amaya. Okay, got
Yeah, Maya. Yeah. Yeah, I hadn't heard when you went through the agenda. I didn't hear the co-ad, so I just wanted to make sure, but I appreciate it and sorry.
it. Sorry about that. Okay. All right, so let me go down. Department of Health and Mental Hygiene. That's a separate, we're gonna hold off on that, unless there's someone else from DOHMH with a separate thing besides rat mitigation. Um, anyone from New York City Health and Hospitals, Metropolitan, Harlem Hospital, Henry J. Carter, Bellevue.
Well, I could do Henry J. Carter since I'm the vice president for Henry J. Carter. We just have our meetings every second Thursday. So our next meeting will take place on May 14th, I believe. Oh. Yes, May 14th is our next meeting, and then the meeting after that will be in June 11th. Then that's our last meeting until September. We are looking for new members, so if you're interested in coming over to become a member, please do. We're in the long-term care. We just make sure that our long-term care facility is getting the funding that we need. Henry J. Carter needs capital funds to do the upkeep of the grounds. So we had our legislative breakfast in February to request for those funds as well. So please join us.
And 6:30 time?
Yeah, 5:30. We start at 5:30 and we're out of there sometime about 6:37. We're pretty early.
And say the address one more time.
1951 Park Avenue is the place. To text you a little bit, we do get stipends for your time.
Right. So all of the cab
Yes, they
members
do.
get stipends, and then most of them also provide food as well.
Yes,
So May 12th.
should be.
You said Thursday, not
14.
Tuesday.
Yeah,
Thank
May
you,
14th,
At 5:30.
5:30.
thank you, Tamika.
You're welcome.
We all know I was formerly on Metropolitan, I am no longer, but, did you say Carlos was? Is
No,
Carlos?
no, he was just using his screen.
Okay, he is the rep, well, you can speak about Metropolitan if you'd like.
Oh, no.
Okay. New York City Human Resources Administration.
You have a hand
I'm
up
sorry.
right here.
Oh, yeah.
I apologize, Chair. I am impersonating Carlos Diaz. This is the CB11 technical line. I'm just helping him with his device to make sure that it's working. Do you hear me clearly?
Yes.
Perfect. So unfortunately, I can't give you that that cab report, but I'll let him know. All right. You guys have a great meeting.
Thank you. Okay. All right. We heard from the Department for the Aging. Thank you so much. Office of Immigration Affairs. Anyone here? Okay, perhaps next time. Department of Veterans Affairs. Anyone here? Next time. East Home Coad. Yes, Maya. Still there. Yes, this is your turn. This is your.
Thank you so much. Thanks a lot. Yeah, well, just a brief updates. We have our member meeting next Thursday. That's gonna be virtual. It's gonna be a presentation. We're trying to do very useful, hands-on presentations that folks can come away with a new set of skills. And so we did trauma-informed response last month. This month is going to be media improving accessibility. Is going to be learning how to create print flyers, digital documents, social media posts with accessible text and images. So it's going to be easy steps you can take with resources for future learning. So it should be something that's very relevant for a lot of our members, and you're all welcome. Again, it's virtual, and you can please email the East Harlem COAD or go on our website for more information, but I'd be happy to share the Zoom meeting for anyone interested. We also have a preparedness training. It's going to be for East Harlem small businesses. That's going to be on April 29th. It's a Wednesday at 9:30 in the morning at Sendero Verde, 71 East 111th. Again, I can share the flyer, but we've done these workshops in the past. They're very useful. Again, hands-on tips for small businesses to prepare for and recover from any type of unexpected events or emergencies. And lastly, I wanted to share that we are going to be presenting as part of the Community Emergency Network Conference. That's going to be on May 20th. It's about mutual aid, and we're going to be talking about community outreach and how to do effective community outreach and organizing around emergency preparedness. So we're excited about that. I will be presenting with Evie Yeager, our community and accessibility manager. So yeah, a lot of fun stuff coming up this and next month, and I'm happy to answer any other questions you might have.
So, and so the events that you're mentioning, please like send the flyers
Yeah.
and okay, good, that'll be great.
Absolutely, of course.
Yes, there's a question from Leslie.
Hi, good evening. This is Leslie Colon. I'm just asking about the emergency preparedness. Is that the same one that was given at the Manhattan Borough President's Office by the military? That type of presentation?
Sorry, are you referring to the small business presentation?
Yes.
I don't know if it's the same presentation. I'm sorry, I'm not aware of the one that was made for the military, but I don't believe that that was our team. This one is it's really for small businesses. So I'm sorry, I don't actually know about the military presentation. I can read you a little bit more information to see if it overlaps, but this one you will leave as a small business owner. You will learn access to assess potential risks, develop simple plans for emergencies that are tailored to your operations. You get practice how to activate and implement your plan, and you can understand how to safely respond if ICE agents do enter or approach your business. So we're kind of trying to tailor it to events that are going on, unfortunately, now. Participants will also receive a certificate and a stipend. So it's a stipend the day of the workshop and then again on the completion of a follow-up meeting. So in total, it's $300 per small business owner that attends.
Okay, now this is May 20th?
Sorry, this is going to be April 29th.
I wasn't asking that one. I was asking about May 20th.
Okay, the community emergency network one. This is the one that's going to be all about a mutual aid and how to do community outreach in your local community. And so we're actually that one I can say for sure has not been previously presented because we're actually putting it together right now. So it's myself and Evie. We're putting together based off of our experiences. Evie being the expert and me supporting with some experience that I have doing outreach in the community. And we're going to be talking and trying to do some hands-on learning activities on that day. That's May 20th. And I can share more information about the exact location. It's going to be downtown, actually.
Okay, I just said military because Manhattan Borough President had offered it for community board members and the military presented it. They
I
weren't
see.
part, they weren't, part of it.
So,
I see. I'm sorry, I didn't understand.
just for a point of clarification, the one that Leslie's talking about is the one held by the National Guard. It's the Citizen National Preparedness. It's where you probably seen it, where the National Guard does a presentation on behalf of the state, and then they give out the book bags, the go bags.
Oh,
That's
yes.
that's what you're talking about.
Okay. Oh, yes, of course. Okay. Thank you for clarifying, and I'm sorry, yeah, I didn't understand that. But yes, this one is going to be it's gonna be May 20th, and it's the New York City Healthcare Coalition or City Emergency Network.
Okay.
Anyone else?
And I can
Thank you.
share more information. I'll share all the flyers and everything just so it's very clear. It's both in person and virtual, so you could attend online.
And so, just so you know, everybody, what, Chancellor just talked about, there's actually a citizens preparedness training happening, sponsored by where I actually work, which is Gutman Community College, on May 13th. And as Chancellor mentioned, this is the one by the New York State, and this is the one where you get the go bag. My school, as I said, is sponsoring one. It's 10 AM. I can pass around the QR code. And I'll send it to the office, so they can post it. We will have food, actually. It says refreshments. We'll actually have food, actually. So it should be really good. So we'll pass that around. And so what Maya talked about was a very specific time when she talked about, the businesses. So this is for like regular folks who want to hear about emergency preparedness. Okay, so thank you, everyone. Other questions? All right, so we're going to move on. Thank you very much. A Center for Comprehensive Health Practice. Anyone here from there? Looking around, seeing none. Housing, anyone from Housing Works Connect? And anyone from On Point? Okay, great. So we'll move on to our presentations and discussion. So first up, is Michelle. And Michelle Cornell. How do you pronounce your last name?
Yes, I'm here, Michelle Cornell. I am so sorry. I didn't realize we were in the general meeting. Alex had already, he's a lawyer, he already had another meeting to tend to. If you want, I'm more than happy to present on the services that we provide. I'm not sure, I believe you were there during the East Harlem Coalition and you heard about what we do, but I'm more than happy to do that at least for 5 minutes for the community, whoever's here. And then, if you want a private session for your actual board members, I would love to still host that workers' comp workshop in the future. Okay, so I will go ahead and share my screen real quick. Okay, perfect. So again, my name is Michelle Cornell Lee. I am the Outreach and Education Program Coordinator for Mount Sinai Salakoff Centers for Occupational Health. And we do like to get started with some definitions just so we are clear on our priorities. So occupational medicine is a specialized field that focuses on the diagnosis, treatment, and prevention of work-related injuries and illnesses. Individuals that are injured during the course of their employment or who suffer from work-related illnesses or injuries require specialized care and may be eligible for workers' compensation benefits. We have two things that can happen to us at work. So we have an occupational injury, which is any physical damage that occurs due to the nature of work that we do, including accidents or repetitive motion injuries, like sprains, fractures, burns. And then we also have an occupational illness. And this is the exposure to certain factors in the workplace that may cause you to become sick, such as chemicals, noise, or physical stress. We do have 4 locations. We are located in Harlem, that's our Manhattan location. We're in Yonkers, Staten Island, and Suffern. And again, our mission at Salakoff is to keep workers healthy and their workplaces safe. We are funded by the Department of Health, and through this funding, we're able to offer 3 free visits for our doctors to determine whether the injury or illness is indeed work-related. Because the process can be confusing and intimidating, our team will assist any patient if they're willing to file for workers' compensation. And I just want to make it clear that undocumented workers are indeed legally entitled to file for workers' comp benefits as well. Immigration status does not affect their eligibility for workers' comp benefits. Care is confidential and focused on workers' health and safety. And again, Mount Sinai Centers for Occupational Health provides care only for work-related injuries and illnesses. We accept New York State workers' comp insurance only. We do not bill Medicaid, Medicare, or private health insurance. Patients must have a job-related injury or illness. So these are just some of the services that we offer, like return to work accommodations. We have screenings for lead exposure, asbestos, depending on the industry. We have prevention, like education sessions, stress reduction, and mindfulness sessions as well. And then we do have webinars throughout the year related to occupational health that we do. I'm more than happy to share that with you all as they come my way. And we also developed a workshop for the youth ages 16 to 21 where we educate them on how to recognize common workplace hazards, how to understand their legal rights on the job, and how to build skills to stay safe and healthy at work. And that was all. This is my phone number and my email. Thank you so much. Again, I'm so sorry that you missed the workers' comp part of the presentation, but I'm more than happy to make that up in the future.
Thank you, Michelle. So by the way, yeah, I did attend the, she did a training, and so, yeah, if you want her contact information, I had that. And this is a little flyer that she gave out, and so if you want more information, then we can have her come back for additional information. But this is very important as it relates to, workers' comp, injuries, et cetera. Any questions? Yes.
How soon can someone get an appointment to see one of the doctors at your center? And also, is there a limit to the number of visits? And then do you have a referral system?
So I believe the appointments are as soon as possible, just because if anyone is starting a workers' comp claim for an injury, they do have a 30-day period to make sure that they report that injury to their supervisor. So we are pretty quick with our appointments. And the second question, I'm sorry, my toddlers were crazy in the back.
No problem. Is there a limit to the number of visits that they have with your doctors? And if so, is there a referral system?
No, so there's no amount of visits. It's just 3 free visits. So first
Okay.
it'll be 3 free visits, and then if indeed the injury was related to work and not something that happened at their own time, they'll pursue workers' comp, and then it'll start billing the workers' comp insurance.
And just so I will say what her contact information, it's her first and last name at, what does that say? And this one.
MISHELL.Coronel CORONEL dash Lee LE at MSSM.com.
And it's a 646, what is the phone number? 946-750-7506.
Mm-hmm.
Okay, let me just say it one more time. 646-946-7516.
Yes.
Okay, great. And I have a card as well. Any other questions from Michelle? Very important information, everyone. All right, thank you so much, Michelle.
Thank you. Take care.
You too, thank you. All right, so thank you for being so patient, Pauline and Martha. So they are going to talk about rat mitigation in East Harlem. Are you guys ready? And feel free to abbreviate your presentation. You're gonna just get to the main points and also make mention of the Rat Academy that's coming to East Harlem.
Hi, actually, this is Caroline Bragdon. I'm doing the presentation today. I think Pauline is not able to be here, but Martha and I are both here.
Okay, thank you, Carolyn.
So I can do a little bit of an abbreviated presentation and hopefully answer your questions or anybody's questions today. I want to make sure we get a chance to talk about the work that we do in rat mitigation, but also most importantly, that people feel like they know how to reach us if they have a question or a concern about rats. So Martha and I are both here. We oversee the community outreach program for the health department's neighborhood rat reduction program. And we also offer the community facing Rat Academy, and hopefully everybody can see my screen okay.
Yes, thank you.
Okay, so the health department, we enforce the health code, which states that property owners are responsible for keeping their properties clean and rat free. And the key activities we have to address rats in neighborhoods and in buildings are we do respond to 311 complaints, and we also do a lot of proactive inspections across all of East Harlem, all of actually Harlem. We do community boards 9, 10, and 11. We also teach best practices for rodent management through our community-facing Rat Academy, and we do a lot of boots on the ground, on-site education. We lead a lot of walkthroughs where we work directly with neighborhood associations. And all of the work that we do is shared on our rat portal, which is nyc.gov/rats. So Harlem is a official rat mitigation zone, which means that the city has put additional resources towards rat mitigation in Harlem. And specifically, that means that the Parks Department, NYCHA, and public schools get funding and staffing to address rats on their properties. There are over 3,000 properties across all of Community Board 11, and the Health Department also inspects every single one of these properties twice per year. So no matter what, if there's been a complaint or not, we always get 2 inspections a year done. In the last round of inspections that we did the 3,000 inspections, and about 439 failed in Community Board 11, which is 14%. This is actually great news because when we first started working in East Harlem, the failure rate was significantly higher. So we're beginning to see rat activity come down a little bit when compared to previous years. It's still higher than we want it to be, though. Especially on city properties. Okay, so I'm going to skip forward a little bit and say that the health department inspectors are out looking for rats when they're doing these inspections and scoring every property for the presence of rat activity. We look for all signs of rats, including live rats, droppings, burrows, gnaw marks, and conditions that could be attracting rats, like buildings in poor repair, clutter, garbage, things like that. Every time an inspection fails, we identify the owner of the property and we send them an official health commissioner's order to abate along with the inspection report. And then we give the property owner time to remediate. And then we go back and we do a second inspection called a compliance inspection. At that time, if the property fails again, the owner of the property will receive a summons from us. And if rat conditions are severe, the health department will just keep coming back every month until we see some progress. So most importantly, what we need property owners to do is to keep their properties clean. And to do this, all garbage and recycling must be contained. And if rats are active on a property, we also need the property to be sanitized and cleaned daily. So removing rat droppings, making sure that all garbage is kept away from where rats are feeding, maintaining the property by closing and sealing all holes, keeping the foundation of the building in good repair. Also, if it's a multifamily building or a commercial building, and if there are any tenants in place, the building must hire a licensed pest control company to address the rat problem. They cannot just do it themselves. They can't just go to Home Depot and buy bait and start throwing it around. They have to hire a pest professional. And this is really important because we see a lot of owners trying to do it themselves. But if owners feel like they need our help, we do have case managers in the neighborhood that are there to provide that help. And they can guide property owners through what needs to be done. They can also help coordinate follow-up activities on properties that may be neighboring properties that are helping create a problem. And so we can help neighborhoods address the problem altogether. We can also coordinate follow-up across different city agencies, in particular, like the Second Avenue subway construction. We've been liaising with them along with the other agencies. For community groups that are in Community Board 11 or anywhere in Harlem, if you're interested in working with us or getting help from our team on a rat problem, we have 3 people on site in Community Board 11, Maria Ho, Rashmi Pandey, and Nisa Mirage. And they are in our Health Action Center, which is on 115th Street in East Harlem, and literally can just walk over and provide help or guidance if needed. And then Martha, who is on the call, leads our Rat Academy. And this is a free rat prevention training that's offered. It can be done with the community board or with any community group. And we do provide a limited number of free bins to attendees through a raffle. We also lead our Rat Pack, which is a program that was started by our former rat czar, but the health department has adopted it, where we train community members to be kind of like anti-rat volunteers, to do activities around their neighborhoods that can help further reduce rat activity. If you need to contact us for any reason, just email us at ratportal@health.nyc.gov. And then if you're interested in pulling down some of our educational materials or also looking up some more information about our work, you can go to our website, which is nyc.gov/rats. That's a rat portal. And on the rat portal, you can get our annual report on the work that we do in rat mitigation zones. You can read about the program. You can actually download data sets on rat inspections if that is what you're interested in. Of course, you can always call 311 as well. We do accept and respond to every 311 complaint that's received. You may, though, sometimes see that 311 complaints are closed as duplicates. Because we're so active in the area, if we have an open enforcement ticket already on a property and you call in a new 311 complaint, that will be closed as a duplicate so we can proceed with the open enforcement ticket. Our Preventing Rats on Your Property guide is available in multiple languages, and you can order them in bulk by calling 311, or you're also welcome to stop by our office if you want to make an appointment and pick some up. We also have these posters that are really great, reminding people, put your garbage in a can, don't feed pigeons, pick up after your dog. I mean, all of these things contribute to rats if they're not done. And so these are just extra messaging that we have in place, reminding neighborhoods that a clean neighborhood is also a rat-free neighborhood. Finally, if you follow us on social media or join any of our anti-rat campaigns, we will keep you in the loop about our events through emails and through social media. And I went very fast, so I'd be more than happy to take any questions if people have questions for me or for Martha.
Thank you so much, Caroline. I think this is very, very helpful information. So you actually, met with some, me and the board office, I think a couple of weeks ago to provide this presentation. Following that, I asked about having a rat academy here in East Harlem. So, and through some, we were able to have a location. So can I just, spill the beans and just say that the plan is to have a rat academy here. It will take place in El Museo on June 15th from 5:30 to 7:30. We're still working out some of the logistics, but for the most part, that is the date of the Rat Academy here within East Harlem. So just so you all know, flyers and everything will be coming out shortly. You had a question?
Yeah, so while looking through the inspections, so just explaining the inspection process. So if there was any signs of a rat, that's an automatic fail. And then second question is, I can't see into the inspection, it just gives me like the basic. If I want to get more information about a specific inspection, how do I get access to it?
Great questions. Yeah, so if we see any signs of rat activity or conditions that attract rats, the property will fail. And the owner will be sent that order, but there's no fine. It's just an order. If you would like an extra copy, if you're the property owner and you'd like a copy of the order, or if you want to discuss it with the office, you can email us at ratportal@health, and we can read the inspection findings and explain what they were to you. If you're a concerned neighbor and you know, we can also give you the details of that inspection. Just email us and let us know what the address is, and we can let you know what the most recent inspection finding was.
Okay, and that same goes for just regular residents of that building?
Yes, absolutely. Yeah. So if it's
Thank
about your landlord, if it's a landlord situation, we can share the findings of our inspections and also what we recommend that the landlord do to respond.
Thank you.
You're welcome.
Hi, thank you for the presentation. I had a question. So this has been a problem for several years, right? And you said that it has improved a bit, but we all walk around and it's still a big problem. What have you guys changed or implemented to see an improvement from year to year? Or is it the same thing being done every year?
I think so a couple of things have changed that have led to improvements. The most important one is the implementation of containerization. As different kinds of properties make progress in containerizing their waste, there's less accessible food to rats, and that's the most important thing you can do to reduce rats is deny them food. The other thing that's made a big difference is the regulation of outdoor dining. Outdoor dining led to an explosive increase in rat activity, and the regulation of outdoor dining has contributed to the decline. So there are far fewer outdoor dining establishments, and those that are in place are now much more closely regulated by DOT and by the health department. Overall, I think, you know, when the city reopened after the pandemic, we saw the highest rat activity we'd ever seen. And as we get farther away from the pandemic, we're getting back to normal. However, I don't want normal to be New Yorkers walking around seeing rats every day. Like, that's still not normal. So that's why I'm saying we are cautiously optimistic that we are seeing improvements, but we also want to recognize we have a long way to go, and that you are still seeing rats in your neighborhoods. We still see them when we inspect. And if you look at our rat maps, you're seeing many, many properties still fail inspection, and that's just not acceptable. But it is better than it was last year, and we hope this year, next year will be better than this year. You know, we hope to see steps of improvement every year.
Thank you.
So, good, you know, that was I just want to just follow up with that because, you know, when you show the map and you show the fact that 9, 10, and 11 have, you know, we are the area that's highlighted because of the number of rats, etc., in and around East Harlem. So one of the things I've made, so first of all, you talked about like the NYCHA properties. That's a fact that we have the largest number of NYCHA properties. And so it's important to educate NYCHA residents in terms of you know, waste mitigation and things of that nature. I'm not picking on NYCHA residents specifically, but we do have the highest number. but also other factors as it relates to East Harlem is the reality of the Second Avenue subway and the reality of the construction that's taking place, the reality of that these little critters are, just being disturbed and are out and about because of the Second Avenue subway construction. That's another reason why, East Harlem should be identified and, looked at in particular. I also want to make mention of, if you go to the open data map, everybody, and you plug in garbage bins, you will see these little dots. You'll see a lot of dots south of 96th Street where garbage bins are. As you go further north, you see less and less garbage bins. And I'm talking about just things that are on the street corners in terms of garbage. So number one, we don't have a lot, and that's a fact. If you actually go to the open data site, that's a fact. Now that being said, one of the things that our mayor discussed, and this is what I mentioned at the meeting we had, is containerization. Those of you who know Councilmember Abreu in that part of Harlem, he is like the king of making sure that I don't know what community district that is, I don't remember offhand, but it's northern Manhattan, and he's all about containerization. And who now spoke about that on Sunday whenever he spoke is containerization. So let's hope that that East Harlem is one of the first to get containers and have containerization. Now I'm going to say this as well. I realize there are like property owners or business owners who are concerned, or even people that have cars that are concerned about these bins taking up space. I'm not a driver. I'm not, and I proudly say that. That's not my concern. My concern is mitigation. And when we talk about the business owners, they may be, concerned about having these bins or other, but the objective is what? Rat mitigation. And what works? Everybody, containerization. So those are a couple of things I just wanted to mention. And also just having the Rat Academy here, I think will be great in terms of informing and educating folks. If you're saying the numbers are going down, then that's good. But education and information is always a good thing, and as much as possible. So I'm glad that's coming to East Harlem. So folks are better informed as to what they can do in terms of rat mitigation. Any questions or concerns or comments?
Yeah, just one more thing. So I'm still on the site and I see something about the community gardens.
Mhm.
How are you guys dealing with that? I know we mostly talked about, landlords and everything, but how are we dealing with the rats that are going into the community garden?
Yeah, that's another great question. Thank you for asking. We have a MOU in place with the Green Thumb program at the Parks Department. And that MOU allows our exterminators and city pest control aides to work in the gardens on weekends. And so if there is a garden that is problematic, feel free to shoot us an email and we'll send someone to treat it on the weekends, and they'll just keep coming back until we see improvements. And sometimes gardeners have concerns about us being in their garden. We're also very happy to be accompanied by the gardeners, and we do Rat Academy specifically for community gardeners. And Martha and I have taught gardening academies in East Harlem. We're happy to do them. If a garden wants to host an event, we'll come in and do a training on site and do a walk around and talk about rat prevention in gardens.
Are you on the Parks Committee?
Yes, I am on the Parks Committee. That's partially why I asked. All right, thank you so much for your information once again.
It's interesting, from the map, you can see that like 2 of the big parks are red.
Yeah. There are, big parks are places where people congregate and barbecue and picnic and celebrate, and that's great. I mean, we want people to be out in parks, but they can't leave behind their food. And that is a problem. And the Parks Department needs resources to keep parks clean, especially in the summer when there's such heavy usage. It's really, we need to see all garbage in cans or better removed from the park altogether. And that's really hard to do in New York.
So how are we, so I know with landlords, we're finding them, but how are we keeping the parks accountable?
So there
Oh.
is a rat task force that meets every month. We meet usually at City Hall, but right now in the mayoral transition, we're kind of waiting to find out who our liaison within City Hall will be, but we usually meet at City Hall once a month, and all of the key agencies are present, and we run down a data dashboard where we'll show like how each agency is doing. So like the number and percent of parks that are failing inspection, the number and percent of NYCHA and schools, and then we'll basically work with that agency to hopefully address the issues. Sometimes it takes a long time. But the parks team is pretty strong. Danny Hernandez is very active. He's the team lead, and generally they're very responsive. So if you have a concern about a particular park, again, we can coordinate and get out into that park and do some treatment alongside of them, and hopefully bring the rat activity down.
Okay. And one thing I want to mention in the Gothamist, there was an article called, it's called Eek.
Yeah.
Rat sightings likely to rise in New York City as temperatures warm up, and I see you're quoted here, Caroline.
Yeah. Yep.
So yeah, that's
We're
that's the survival.
we're bracing for it, guys. It's this is the first day we hit 80. As soon as it's warm, the complaints come pouring in, and we're ready for it, but we're also bracing for it. It's never fun when it gets warm. More New Yorkers are outside. The more we eat outside, the more we feed rats, and the more rats we're going to see. And so it's really kind of a give and take. Like I said, I want people to be outside enjoying the weather. I want to be outside, but we have to be aware that our habits can really attract rats.
Thank you. Any other questions or comments? Okay. All right, so look out for the Rat Academy. By the way, there are 2 Rat Academies coming up. Wait a minute, April, yeah. So this is, and when we have our Rat Academy, we were talking about sponsoring with MTA due to the Second Avenue subway issue. But there's a Rat Academy training sponsored by the MTA, you guys, on April 23rd, from 5 to 7. And then there's another one on, so March, wait, April? Yeah. So this passed. So yeah, so there wasn't in March, so there's one coming up on April 23rd, and I will, I guess, send this out to folks. All right, and look for the Rat Academy in East Harlem, and when we get the date and all the stuff and the logistics, spread the word, everybody, spread the word.
It's on the website already.
All right, okay.
So
As soon as we get the flyer, we'll circulate it. Our staff member who composes the flyers is just back from leave, so we'll get those to you as soon as possible, and we'll start circulating. And yes, we're already promoting on the website, so we're hoping for a great big crowd, and we will be doing a NYC bin raffle during the event as well. So we're excited about it.
That's very important. You mentioned that bin that's being raffled over.
So Second Avenue line, all those pits that they've been digging up, they've disturbed a whole community of rats.
Yeah.
Okay, they're big, small, brown, light brown, dark brown. The piping that is on the sidewalks, they are festering in there. So when you might think you see a rat, it could be a raccoon. Yes, they're raccoons.
The other day.
Okay,
Wow.
it could be a skunk.
Wow.
So be mindful of what other animals are festering in all that construction that's going on. Because you might think it's a cat, it's a rat, or something else. So yes, it's a big manifestation of four-legged animals, especially nocturnal animals.
Yeah. Okay.
So Franklin Plaza is very much aware of it, and they're overutilizing our exterminators because of that.
Okay. So we should have all of the Franklin Plaza out of the Rat Academy.
No, somebody gotta pay for the exterminators to be back.
All right, so thanks again, all the folks, Martha, Caroline, who else, I'm sorry, who else is, and everyone, thank you so much.
Thank you for having us. We'll hope to hear from you.
Thank you all.
Okay, thank you.
Thank-
Bye.
Okay, bye-bye, thank you. So, to finish up, everybody, one thing I do want to make mention of is anyone else that is wanted to speak or from an organization? I do want to make mention of this budget request submission form. It's a hyperlink that when you click on it, you can submit things. So every committee has that on their agenda. That's something that is it the budget folk committee sponsor spearheading this? In any case, it's there. So that's a budget request submission form. You can actually click on it and submit things. And maybe that's why we received this request from this individual. I sent out to you, she sent this was sent, Saturday, Rebecca Mead. Yeah, I saw, Jennifer had some questions, same questions I had. Number one, there are several, senior centers in and around East Harlem. And I actually went to our webpage, actually, everybody, I actually, website, and I actually printed out, like, if you go to the Health and Human Services, you could list all the Carter Burden, right up the block on 109th Street. And just yell out, senior centers, right? Yeah, so, right.
The North,
Right.
Jefferson, the North,
Yeah.
Johnson.
Yeah, so this person is saying they renovate or upgrade, okay, but then also we need to have a senior center that is walkable. I mean, I don't know where this person lives. We need more information because I do believe that there are centers that are walkable. So we will look more into this. I wanted you all to see it if you wanna. So again, I just went to our site, but then let's hear from one of our experts as it relates to older adults and seniors, none other than Robin Streisand. You're muted.
You're muted. You're muted, Robin.
Oh, you're still muted.
I believe this person lives at 99th and Lexington.
Okay, oh, good.
Within walking distance, there are two senior centers. Granted, they're smaller. There's the Washington Lexington at 1775 3rd Avenue.
Okay.
And then there's the Carver run by Acacia at 55 East 102nd.
Right, yeah.
If the person's issue is they're not the big centers, well, I'm sorry. If you can try to get on a bus, there's so, as we all know, there's so many. And I think probably the closest one would be 10 blocks north of where she is, going to Cavello. Or she could go east and go to Isaac Center.
Mm-hmm. Yeah, right.
I mean, there's lots of choices. You just need to, maybe mobility is her issue. If so, I've just identified two that are the closest to her.
Thank you, Robert. Yeah, we need more
Very
information.
welcome.
Are you gonna email her back, just to get more information?
Oh yeah. So just Saturday, let's say Monday. So yeah, yeah, there's more information needed, and then we'll get in touch with this individual. That's definite. And then, but the person also says renovate or upgrade a senior center. So is there one in particular they're talking about? So more information is needed. And the first thing was to find out where the person lives. So thank you, Robin. And then we'll explore this a little bit more. But excellent question though. All right. And the last on our agenda is the moratorium document. So thanks to I'm going to say Ada in particular for a lot of, but everybody else there also. But you were very, very helpful in getting all of the edits done. So this is the document, everyone, that we're looking at. This is the final version that we're going to vote on ourselves tonight. It is 7:53, which should be done by 8 o'clock. So I guess I'm supposed to read this whole thing. Is that correct? Well, they got it in advance, but if you want to read it out loud, you know, right?
I think there were only a couple of minor changes
Oh.
from, like the last file we reviewed.
Yeah.
So I guess let's focus number one, like if you're saying, like the major changes from the previous document. And then so for folks at the general, what's that called, the full board meeting.
Right.
There, we can just focus on those things. So you wanna? Okay.
Sure, so from last time, everybody reviewed it and we agreed to add describe what the substance use facilities would be. So, we said that any program, clinic, or site licensed or certified by New York State Office of Addiction Services and Support. So that was added as is the third one. That was the new part, and then, we took out the 12-month and we made it indefinite until we come up with another resolution or moratorium. I think those were the only two, and then there was a change on, now therefore be resolved on that section, but it's just because it was mentioned on the third one, because we had said which facilities, so we actually specified which ones.
So I guess I'll take a step back and just say, that, so this was, done some years ago, and, it was brought to our attention again in terms of, the document had lapsed, and now we made the change in terms of more descriptive, in terms of the services, and then we also said that it should be indefinite. I'm gonna say that the bottom line of this document is to say that, we are saying that we as a board, as a community, want to be made aware of any of these treatment facilities or services that come. We should be made aware. I guess I'll just go down to the be it resolved the parts, because that's what we're talking about. That any sitting of any new substance use treatment facility as defined herein within Manhattan, I'm on page 3, everybody. Within Manhattan Community District 11, and any expansion of service capacity at existing substance use treatment facilities as defined herein within Manhattan Community District 11, and that the moratorium shall remain in effect as of the date of adoption of this resolution, and only dissolved by subsequent affirmative action by on the part of CB11, et cetera, et cetera. So those are the main things. So the point is that, Oasis as a New York State entity needs to reach out to this board and let us know of any changes of any service, and also if there's any new facilities coming, because based on the data that's in this resolution, there's an overabundance of these types of facilities. And the bottom line, also want to say, we're not saying that there's anything wrong with these facilities. They serve a purpose. I'm the first person to say they serve a purpose. It's just that if we are overburdened, then we're going to speak up, and this is our way of speaking up with this moratorium. Any questions, concerns?
So we are putting this in a motion in this tonight?
Oh, yes, there's gonna be more, but I want to read more of these.
Want to be sure?
Yeah, because we're gonna vote. So then number 2 says, provide a list of all Oasis authorized facilities within Manhattan Community District 11, including ownership, funding sources, authorized capacity, residency, distribution, outcome metrics, and compliance status to support CB11's charter mandated advisory role. So we're saying, you know what, we need that list, and all the details therein as it relates to these entities within Community District 11. 3 says, provide a corresponding citywide list of Oasis authorized facilities by community district, including authorized capacity and service type, to support evaluation of equitable geographic distribution consistent with fair share. So those of you all should be aware of what fair share is. That's been talked about, I think, at community board meetings. There's something called fair share, where we look at the equity of a whole host of things as it relates to substance abuse centers, as it relates to sanitation facilities. There's something called fair share, where whenever these things are cited, whatever it might be, that it's done equitably. So that's what we're talking about in this instance. And then we're asking for a list from Oasis to show, okay, if we look at Community District 11, we see there's 25. We look at CB5 in Lower Manhattan, there's 2. One might say, how is that equitable? Number 4 says require Oasis off. Are we done? No.
Yeah, you did.
Right, no, not number 4.
Oh, I said, yeah. Number 4.
Require Oasis authorized facilities located within Manhattan Community District 11 to appear before CB11 no later than 120 days prior to reauthorization, renewal, relocation, expansion, or increase in service capacity. So that goes back to the first when we're saying the sitting of new, actually sitting, this is siting. There's 2 T's in sitting. The sitting of any new facility, et cetera, et cetera. So, that there's a period of 100, we might have put there before, they should come before us. Well, let's give them a time frame, 120 days. I think that's a reasonable time frame. And then the last, conduct and publish a citywide fair share and cumulative impact analysis evaluating the geographic distribution of substance use treatment capacity across New York City's community districts, alignment between documented overdose burden and facility sitting, socioeconomic vulnerability indicators, and cumulative neighborhood impacts. So just so you know, as I talked about fair share, make sure things are done equitably, but then there's also the cumulative impact analysis. Do you know what that means? That means that we have a sense of what that means, right? So the cumulative impact of having these locations in and around East Harlem, how does that impact us over a span of time? So we have to look at the cumulative impact of that. So we want some analysis. We want some data about that. There's some references at the bottom, and we have a lot of data information contained within this resolution. And right now, any questions on this document? This point. So at this point, there's some logistical things. So we've obviously made some changes in terms of chair, the date, human services, and then at the bottom, I went in there and made some changes. I think you did as well, and I added to that, a couple of things. Thank you, Marlene, for clarifying a couple of things as it relates to the secretaries added on there. I'm also going to say this. In my draft, I put, we can debate this, but CB11 members are referred to as honorable. So in my draft, I put honorable at Adem Brihas, chair, and I put my name under my name, and I put under Rosa Diaz's name. Is that up for debate or question?
Angel reviews our work, and so he said to take it off. So if you have a question about that, you have to speak to Angel.
And I will, because we are referred to that. I mean, it's not a big deal for me, and you could look at other community boards, and yeah, we are at honorable. All right, other than that, I'm going to call for a motion to adopt this document, specifically the moratorium on the sitting and expansion. Is it citing? Maybe it's citing. Is it citing? It's citing then.
It's citing.
Yeah.
Has 2 T's.
Yeah, no, but we're talking about the citing or sitting.
Citing.
Okay.
Citing.
Okay, thank you. And expansion of substance use treatment facilities within Manhattan Community District 11. That doesn't really encapsulate the whole point, the whole totality of this document, but we'll just go with that in terms of in terms of that. But is there a motion to accept this document or a motion with this document?
Yeah, I'll set the motion to adopt the edits to the moratorium of the sitting and the citing and expansion of substance use treatment facilities within Manhattan Community District 11.
Okay.
I'll second.
Second, okay. All in favor?
Where Joe?
Aye.
This is
1 second.
This is as per Adem. He wants you to restate the motion after it is seconded before you guys go into a vote.
So there's a
So I
motion.
second the motion of the moratorium on the citing and expansion of substance use treatment facilities within Manhattan Community District. No, Jewel is supposed to do it as the chair.
Oh, I'm sorry.
No problem.
So I'm just repeating everything again, so just.
Yes.
Okay, so so there was a motion made by Chancellor to adopt this moratorium on the sitting and citing and expansion of substance use treatment facilities within Manhattan Community District 11. It was then seconded by Leslie.
Hold on. What I wrote was, what Chancellor said was, and it's up to you guys, just correct me if I'm wrong, adopt the edits to the moratorium, or I heard edits.
Yeah,
Yes,
so
yes.
that's what it should be, the motion, because it's already thing, so we're just adopting the edits to it. Right? Am I correct on that?
That's up to you all as a committee. I'm just writing down what.
I don't, that might be confusing to folks. Let's just.
No, because we added, right? It was added to the record.
Right, so I don't know exactly.
So both of you talk, so say.
I'm sorry, I think it's correct on what he said because we added something and we reiterated whatever, so if he says that this is the motion that we're gonna accept the motion that was already edited,
Okay.
so.
Because the moratorium's already on the website and everything.
Right.
So this is just the.
Oh, I thought you were referring to the last time, not the
No,
one.
No, so,
The original one you're talking about.
so the original one is still on the website, it's technically still active, so,
I see.
that's why I made the motion for the adoption of the edits
But
into.
that had expired, right?
Yes, so yeah, the important part of that is that that has expired, so, one
So
might
this
say
is
it's not
a,
active.
so we're basically saying this is a brand new moratorium, right?
No, it's not.
Say again?
It's actually revised.
It's revised.
Yeah, I guess.
It's revised.
Amended, like they amended or amended.
So we're gonna use an amended or revised, which,
You have a hand.
Jennifer has a hand up.
Yes, Jennifer.
Yeah, I apologize. I'm just looking up the revised edition now, and I fear it's going to raise some of the same questions. Can you like explain how exactly the definition of treatment facilities was changed from what we worked on last month until this month? Because I feel like we're bringing it right back into that gray area where it seems like anything could technically qualify as a substance use treatment facility.
On the third one, where you said have what, did you read the third clause? It was added, it was not there before?
Yeah, to me, that brings us right back to the original one, which I thought we were trying to change. Because if we're saying any outpatient treatment, that includes therapy for people who might also have substance use disorder, so I thought we were specifically targeting safe injection sites.
So if you're looking at, it's very specific and yeah, and when we did, that was very intentional. So that's the definition what we're going with in terms of describing these facilities.
Yeah, I would just say, I don't understand how that's any different than the original moratorium, which we wanted to edit. Because we were running into problems where anytime someone was coming up and they provided any sort of anything to people with substance use disorder, that we were running into this problem where we, from my understanding, wanted to be specific about.
We're specific because last time we didn't have program, clinic, or site license certified by New York State office, and then what they provide, so we didn't have this information before. Residential treatment, outpatient treatment, medications for opioid use disorder, and the clinics, and like what are the actual sites. So how can we be more specific? Can you tell us?
I would say we're including too much in it.
So, I mean, so this can go back and forth like 15,000 times. First, we're saying that it wasn't specific enough. Now we're saying there's too much. I'm gonna.
I'm saying, no, I'm not, I'm saying it was not specific enough, and I thought at the last meeting, we made it as specific as it needed to be. And now you're adding in, since the last meeting, more stuff has been added in that I don't think was the heart of this document. So we want people with substance abuse disorder to still be able to receive therapy in the community. Based on this document, I no longer see that as a thing, since that is considered outpatient treatment.
I was under the impression that this moratorium was stopping any more.
Right, additional ones, yeah.
Additional ones in the community.
Right.
We're oversaturated.
We're just saying, what are these treatment facilities? And then on the the ones that Jewel read, it's telling you if they expand or they grow or they wanna open new facilities to come and provide us with data.
Yeah.
So I guess is the committee saying now, if an organization is offering therapy to people with substance use disorder, we don't want them to expand their therapy services in the community?
We're saying that, let's be very clear about that. We're saying that any new facility that's coming, we're just saying they come before the board within 120 days. We're not saying nay to anything. We're also saying that if you want to expand any facility, you come before us. And that's all we're saying. And then what we did in terms of the revision was to say more about what these locations or facilities are. And I believe we've done that. Well, and so let's make sure we're talking about, we're all saying the same thing here. It's like, we're not saying no to things, we're just saying that, let's take a breath before anything else comes. You come before us, and that should be a natural thing for any entity, that they come before us, and we hear about these things. That's what this document is
I
saying.
guess that wouldn't be a moratorium then, because a moratorium is asking you to stop or to halt or to no longer put in place when we ask.
And the moratorium part is the time frame where we're saying this is indefinite. That's the moratorium part. That's the time frame part. It's indefinite. Whereas before.
Yeah, I mean, I disagree with what's based off of what is written, but if everyone else agrees, then
Okay.
that's fine.
Any other questions or concerns? We're in the middle of the motion. Okay. Did I finish?
But we were trying.
Oh, revise.
Revise.
Yeah, revise.
So.
Right, okay.
I would like to make a motion to adopt the revised moratorium on the siting and expansion of substance use treatment facilities within Manhattan Community District 11.
And I second it.
So, we have a motion made by, Chancellor to, adopt this revised, moratorium on the sitting and expansion of these substance use treatments facilities within Manhattan Community District 11, and was seconded by Liz. All in favor? Aye. Any, opposed? Any abstentions? So I need to hear, verbally from Jennifer and Robin.
I am not in attendance today. I don't have an excused absence.
Yeah, right, that's right. So then Robin, did I hit the, she's, oh. Yeah, we can,
I'm in favor.
okay, so that, and I say yes as well. Is that everybody? The motion passes. All right, good. Thank you, everyone, for your time and attention. When I present this, I'm going to stress what I've just stressed right now as in terms of what we're trying to do. And I think the idea behind all of this is that, again, there's a pause before Oasis, has these entities within the community district. I think that's what we're talking about. And then this pause is indefinite, where, you must come before us, and we're saying between a certain period of time, 120 days. And I'm going to state again that it is not, there's no critical statement being made about these facilities, not whatsoever. I guess all we're saying is that, as it relates to fair share equity, there may be more within the community district of 11. All right, thank you, everyone, for your patience, and again, for everything. Let me go back to the agenda. I think we.
And
Yes. Oh, new business.
Yeah, I just wanna, so, Adem sent out the email about the city-owned grocery store.
Oh, yeah.
That's gonna be at La Marquette. I was hoping that we as a committee could, potentially make sure that we are heavily involved in this, as, food is a huge human service, issue, since we're in a food desert. And so in that article, I didn't see which city agency is gonna, lead it. So hopefully, you or someone can help us figure out what city agency will be leading this, so we can have them come here to the committee and ask questions to make sure that, it's properly done right, there's many things And I can see other committees like the Economic Development Committee and Youth Education being part of this conversation as well.
Yes, so yes to everything you just said. Yeah, and Dem sent that out, and I actually, printed out the Times article. Yeah, this is very interesting, La Marqueta. And as someone who's been in the community, for like decades. You know what? Well, you've maybe heard. Your grandmother told you about what was then, like decades ago.
I seen what was there.
But like, like when it was like black and white pictures.
Yes.
When like the blocks, and it was just like open market, and
Really?
yeah, it was like blocks long.
And I know they just got a renovation, which is very, I think they're finishing up that as well, so.
For the dance area?
Yeah, but just in general, so, very, very interesting to see how this is gonna look. And I'm glad it chose East Harlem, obviously,
Yes.
cause I was wondering where they were gonna place it. And I'm glad it was this location, maybe Bad Bunny showcasing it on Super Bowl. So, yeah, I just wanna make sure that we're heavily involved in this.
So, in those of you born and raised, yeah, I'd like to hear from you. Like, so, like, what are your thoughts about this? So,
I'm glad they're bringing it back because it instills the culture here. As a child, my grandmother used to walk me through it, and it was very distinct that things that you can't get in a regular supermarket were over there. The certain fruits, the certain vegetables. So they had one area which had the meats, all kind of meats, fish that was under the train in one section. Then you walk through to the next part, and they had tailors. They had silk, they had fabric,
Wow.
anything that you wanted to make, they had it there. Even the different color threading, the needles for the sewing machines, they had it there. Then the next one was the food,
Very cool.
all the vegetables, things that we couldn't get in a regular supermarket that culturally we would eat.
Right.
The yuca, the yautía, the calabaza, all that
Right.
stuff. I mean, we can get pumpkin now, but it's not what we're used to. Pumpkin, like Halloween pumpkin, no, but pumpkin that we would make to cook with. So that was the culture
So
here.
different cultures.
Right, so if they wanted something, like if basic cilantro, nobody knew what cilantro was until they came here and they started making it and putting it in the food. And a lot of people were figuring out, oh my, it tastes different. So it was always here that you were able to get stuff. And then 116 expanded with all the other stores. But the Marqueta was the cultural center of that ethnicity here. So everybody, on Saturdays, you could see everybody going back and forth, and it was the little kiosk. And everybody trusted one another. It wasn't about, kids stealing stuff.
Right.
Everybody was right there, and it was a business, and it kept it here. The dollar never went out of the community. It stayed here. Next question.
and so, some of the initial comments that people are making. So it's centralized within East Harlem. We anticipate folks coming from like across the boroughs coming here. Do you have any concerns about the pedestrian or parking or that aspect of it?
There is no parking here.
I don't
like the fact that the city bikes will be put in the streets, taking away parking for the local people, for the residents. City bikes, they could be put on the sidewalk. The sidewalks are big enough.
How big is it gonna be, do you know?
It should be three, because 116 to 115, that's where they have the dancing. So then 115 all the way down to like 112 is where they usually have, and then from 112 to 111. I think that's the garden area. The garden area is right there. 112, yeah, it's right there. So it's not that big, but it will have enough space for a lot of different kiosks to be inside.
So, and that's part of my wondering like what's the rendering of it, since they're saying it is gonna be a city-owned grocery store, and the idea of what city-owned grocery stores look like. You can look at how the military does their run stores as well, with government run grocery stores. So more is like, how big is this gonna be, right? You said it's gonna be like that, but at the same, like you're saying, like there's different kiosks and things like that. So that's why I want to be having part of it.
And I think the one that they opened downtown or somewhere, they had big lines, so I wonder how the safety of pedestrians will be handled, especially like on Park, that's.
Yeah,
What, the
that's,
Chelsea Market one?
Was it Chelsea? No, I thought.
no, it was a private company that did a free store.
Right.
Yeah.
For like a
Oh,
week,
yeah.
and that had different kinds of people.
Yeah.
But, you know, this has potential, as you said, other people from other boroughs may come, because it seems like we're gonna be the very first one to open, so there's gonna be a lot of attention on it. But then we also have, I don't wanna say issue, but, you know, our residents in the community that are dealing with substance abuse, like how are we dealing with them during, in this area as it picks back up and everything, security. There's a lot, there's a lot of questions, and then because of how, you know, how Park is one way down, one way the other way.
Right.
So.
What we also have to look is the traffic pattern.
Yeah.
And the
Yes.
deliveries of trucks
Yes.
zoning.
Yes.
So if they get that, grocery store, well, we're gonna have to require or request that they don't have the 18-wheeler trucks.
Yeah.
The smaller, like U-Haul trucks that deliver for these stores and at a certain time, because like you said, at Park Avenue, you have the residential parking and then there's that one block.
Yeah.
And then they narrowed it down so that it used to be 2 lanes, now they narrowed it to 1 lane to reduce the speed traffic. So now if you have a delivery there, he's gonna take up that lane.
Right, it's gonna block everybody.
It's gonna block everybody. So that'll be one of the issues that we would have to take into consideration when they start this. The deliveries, the traffic zoning, you know, deliveries at a certain time of the day.
The lighting and all the stuff.
The lighting, the cameras, the speed bumps, the speed cameras, the traffic pattern, the pedestrian pattern.
I do say the lighting has gotten better there because we're already doing their remodeling of those awnings of the subway track right there, so the lighting has gotten better, obviously it can be much better, but, this is.
Also, can there be like some kind of request where they employ people that live in East Harlem?
Yes.
Yeah.
So this is gonna span across many
Several,
different committees. So I guess for our purposes, like we can like maybe focus on you know, the health aspect of it, the vendors, we have a say in terms of the vendors, you know, and make sure, you know, that it's quality and the affordability of it all. Yeah. So lots to think about. So thank you, thank you for bringing it by. Had the article I was gonna mention it. I'm sorry, that was left there as well. So that talks about cooling centers. There's that other document there. So, cooling towers. And specifically in terms of Legionnaire's disease infection. So take a look at this. I'm not gonna say that it hasn't hit us within CB11. But you know, it's more so Harlem Hospital, that area, but still we should be made aware of this.
No, I'm saying, technically, because we still have that upper part of CB11.
That's true.
So, that like 145 area, so, even though it was mostly towards it was really contained to the hospital and everything, that area was being really heavily watched for it, so we want to say that.
So take a look at this, like, you know, and everybody take one, we want to discuss it further next time around. Okay, so that was new business stuff, and I'm sorry, I meant to mention this. Silverman, I'm gonna send this out. So Silverman is having a aging with resilience, and on May 1st, strengthening communities for a healthier future. May 1st, Silverman is doing this, and then also there's a oral health for older adults, key considerations and care strategies. This is the 23rd, 10 to 11. So all these things I'll send out via email. Okay. So new business, old business, anything else? New business? Oh, yes, Robert.
Hi, it may have been discussed at a larger meeting, but let's not forget about participatory budgeting. And it, I'm concerned about it because, I run a mentoring program at a public school on 106, and they need money for their to improve their bathrooms. And this is a real need. You'll see other schools there with very similar needs. So this is one of the only ways these schools can get help. So please don't forget to vote. Thank you.
Are you saying that that's, so, you know what, so years past, when this, when this was first discussed, obviously, well, I should say obviously, but Melissa Mark Viverito, and this
She was a
district.
pioneer in it.
Yes, she was. And I was personally very active. I would go to they would have the different locations where you would vote. I don't really see that happening as much here, much anymore, but this is very important. You have a school, you're in a NYCHA property, you need lighting, you're in a school, you need a ramp, ADA, ramp, you're in a building. So this is where you get you put your project there and folks vote on it. Are you saying that this is an item that to be voted on, Robin?
There are probably, I think, 6 or 7 items in Councilmember Encarnacion's district, which is our district.
Yes.
And I know that 3 of them, at least, probably 5 of them, have to do with school issues. You can vote
Okay.
for up to 3.
Okay. I didn't see that. Let's make sure that gets out, 'cause I haven't seen it. Anyone
And
else seen it?
you need a cell phone to register.
Yes, cell phone registration. Yeah, so whoever has that, please send it out. And for some reason, I have not received that because we all should vote. Make sure we vote on these items.
I don't have it. I heard about it and I had to search for it.
Okay, I'll do a search. Thank you for bringing that up.
You're welcome.
Anything else? Anyone else? I think it's roll call and then adjournment.
Rosie Cologne,
Present.
Anna Parisi,
Present.
Chancellor Gray,
Present.
Jill Jones,
Present.
Jennifer Myers absent for this meeting, Tanya Phelps,
Present.
Valerie Ponte, absent, and Ron Administration.
Present.
Right, I think we are adjourned. Thank you, it's at 8:25. Thank you, everyone, really, I do appreciate everyone and your participation. Thank you, thank you. Get home safe there, Robin.